My name is Heather, and I lost my son to suicide. His name was Ethan. He was 15 years old. It was a Wednesday afternoon in April. He had an orthodontist appointment that afternoon. I took him to the orthodontist just like any other day. He seemed a little off. I took him back to school. I thought he wanted to come home with me that afternoon. I told him, sure, get your stuff from school, we'll come home. He said, nope, I'll be fine, Mom. Those were always his words, I'll be fine. I always feel like I should have known something was wrong. It seems like the what ifs will eat a person alive. He decided to go back to school. He went to track practice that afternoon, rode the late bus home. The bus driver that drove the late bus that night said he was laughing, had the biggest smile ever. Anybody that knew him always said the same thing. His smile was contagious. There's not a day that goes by that I don't think of him. His brother and his sisters miss him. His father misses him. His classmates miss him. They go through milestones in school without him. They're planning prom. His class is graduating next year, and they're not quite sure how to continue without him. So it's not just our family that has been impacted by his suicide. There's lots of people that has been impacted by his loss. It's not just us. The pain doesn't get easier. People say that time heals. That's a lie. Time doesn't heal anything. You learn to live with the new normal, whatever that may be. But it's not easy. Just know that I always say for every dark night there is a brighter day. Even though things may seem tough at that very moment, there is help out there. It's not always doom and gloom. It will get better. There are resources out there. There are people that will help you. And there are people that love you. And your life does matter. No matter how bad it seems, it's not always going to be that bad. I just wish Ethan could see how many people truly love him and care about him, and how much his death has hurt us all. I just encourage anybody just to reach out to anybody and just get help. I think there needs to be a lot more resources in school for sure. There's a lot of kids that don't really know where to turn to. You know, they're struggling. You see a lot more depression and anxiety and mental health issues all the way around, and when you have those kind of situations in school, who do they turn to? There's a lot of issues, you know, with home lives and attendance issues, and it's just a whole lot of other issues all balled into one, and you don't really have enough resources as it is to address those issues with all of the kids. So if we could get those resources in the school for the kids, I think that would help a lot with mental health and suicide. I think my greatest goal for today is that I wanted to let people know that are considering suicide is that you're not just ending your pain. You're creating a whole lot of pain for everybody else. I watched my family hurt for the last 2 years, and it's been an uphill battle for not just myself, but for my other 3 living children, for my husband, for our extended family. for Ethan's classmates and his friends and the whole school. I've seen teachers hurt and kids from other school districts hurt, and for them to shed tears still 2 years later over his loss, you know that his suicide did not just hurt us, it hurt hundreds and hundreds of kids and adults and lots of people. So anyone that is considering suicide, just know that it's a temporary thing that can be fixed with help. So reach out to someone, anyone, even if it's a phone call or a text or professional help, because it can be helped and it can be fixed. And I don't want anybody to feel what I have felt for the last 2 years.
Suicide, of course, is an important concern in the mental health world. You know, according to the CDC, you know, it's actually been, you know, creeping up in terms of the rates here lately. You know, of course, suicide is when a person is feeling hopeless, and they might start to have thoughts of ending their life. And it can be kind of on a spectrum too, because there can be people who are really ideators, people who chronically think about it. And then it can progress to the point where people are actively planning and intending to end their lives. And so in the mental health world, it's not uncommon at all to be talking with somebody who has struggled with suicidal ideation. It's pretty common in that respect. But of course, it becomes more concerning as a person starts to think more and more about planning to end their life, and then of course talking about intending to end their life. So it is certainly, in terms of risk signs, it certainly is increased when a person has a diagnosable condition. At the same time, it's also difficult to really fully know, because some of the estimates that I think the CDC put out recently is that 54% of people who ended up completing suicide didn't have a diagnosable condition. So in general, part of what we're looking for is when it's probably most concerning is when a person is thinking about death a lot, when they are maybe researching ways to end their lives, and certainly when they're saying, you know, I don't want to live anymore. Those are certainly more acute in nature that's important to be attentive to. Otherwise, you know, not everybody is really actively advertising their thoughts, and so what we might notice is that they're being more withdrawn from friends and family. They may just seem more hopeless and feel like they're lacking purpose. Maybe they've increased their substance use and they're drinking more or using drugs more. Maybe you know, a loss of a job or a significant relationship might spark some suicidal thinking. And so those are certainly factors that we want to be attentive to. But again, suicide doesn't really have a single factor that's really predictive of it. It's not that easy to predict. It's a very difficult one to predict. And so the reality is that a lot of people just don't always see it coming, because either we don't have direct connections to what the other person's thinking, or there's just so many different variables that are really hard to track, and one combination in one person won't result in an actual attempt, and another combination in that same combination in somebody else might. There's still a lot that we have to learn about suicide and what happens when people are really suicidal. I think it's important to be okay to talk about it. One suicide myth that's out there is that you shouldn't talk about suicide because it's just going to make them think about it more. You know, I can tell you as a provider that people who struggle with suicidal thoughts are thinking about it all the time anyways. You know, you asking about it or not isn't really going to change that fact. The benefit, though, that I think comes with it is that it's okay to express that. In general, we know that emotional problems become worse when we have to suppress those feelings. And so when people are allowed to talk about their suicidal thoughts or the lack of purpose or the things that bother them, I think that it actually helps facilitate them feeling better. Just the attention to the concern certainly does, can be helpful. So I think not shying away from it, not trying to ignore it. If you feel like it's there, if you have a hunch, I think it's okay to ask that question of a person. If you have the sense, however, that a person really is actively planning it, so if they seem to just have more of an intentional plan, so they're saying it, you know, like I mentioned earlier, if they're really actively researching ways to end their lives, if that sense of imminence creeps up, if you know, then I think it's important to consider, you know, that in you know, certainly Becker County we have the 24-hour crisis line, you know, the 911 or the ER, and so if it really is emergent, it's important to act. But if you've got the sense that a person is starting to kind of drift into a darker place and they're starting to struggle with suicidal thoughts, it's absolutely okay to talk with them. Of course, too, if it really does seem to be imminent, I think it's important to be mindful of the environment. That sometimes people do act impulsively, and certainly with substance abuse disorders, where maybe a person might not seem to be overly depressed or very suicidal, but if they are, you know, drinking heavily or abusing drugs, that might impair their judgment, and they might become a little bit more impulsive. And so I think it's important that if you start to suspect that there are some emotional concerns that suggest suicide, to try to be mindful of the environment and try to keep a safe environment overall. Just really minimizing access to anything that would make suicide or an impulsive moment really lethal. If you're a supportive friend, if you're a supportive family member, we naturally want to empathize with that other individual, and so we sense the pain that might come up if we ask the questions. But from my experience, I've had a number of people who will actually say that it's a relief to hear about it. So I think that we have to be mindful that the fear we have in bringing up the topic may not actually be the feeling that they have. They may actually be very relieved that they're able to talk about it. And I've also heard people say that they'll find themselves in these suicidal modes, and they look back retrospectively and they say, yeah, I wasn't really thinking in my right mind. And so I was really happy that this person brought it up. I was really glad that somebody did something, because that wasn't me in that moment. And so I think that it is a challenge, but I also think that sometimes we have to see beyond the relationship, and that sometimes you might ruffle some feathers, but on the long term, it might make a huge difference in that person's life. And so it is uncomfortable, but if it's worth saving a person's life, then try to really tune into that this is a really important life-saving question. It might really change things for that person. For family members and friends, then, in terms of being supportive of a person who is in distress, in acute distress, I think it goes a long way to simply be able to hear the person out. You know, what I hear from patients is that what they find is that when they feel really invalidated, that what they feel is not true, that tends to be more distressing in a way, because for them they feel like it is very true. And so I think the ability to listen attentively, to be supportive, to acknowledge their feelings, I can't overstate enough how important that is to people, to just feel accepted. I mean, essentially, experiencing a non-judgmental, accepting attitude is really important and therapeutic, I think, in and of itself. I think it can also be true that they can feel this way and you can see this. So, for instance, if they say, I feel completely worthless and I'm no good, I'm a nobody, it's possible to say, yeah, I hear it. You're feeling pretty down right now and you feel worthless. But I'll also tell you that from my perspective, I see these other great qualities, and I get that maybe you don't feel that way, but I do. And so in that way, you can be supportive, but also provide information that also, you know, counters a little bit of that narrative of I'm such a horrible person. So you're not fighting them on what they should think or feel, but you're just adding in more information that hopefully widens their own view of themselves. And then I also think that it's important to say, what are your thoughts about seeking help? It sounds really painful. Would you like, would it be helpful to talk to somebody about this? I think that in general people don't respond well to being told what to do. But if you can encourage them to think about, is this helpful? Or is the place where they're at, so maybe they're doing things or not doing things for themselves, is this helpful? And what do they think they need to find help? I think it can kind of steer it out of a very dark place, but then asking some supportive questions of, what do you think you need? What's it going to take? What do you think would be helpful right now? And what do you think you need? What do you need from me? I think that goes a long way to help shift gears out of, I'm in such a dark place, to, okay, well, I maybe would need to find a person that I connect to, or I need to find better medications or a different medication. It gets into a little bit more of a solutions, per se. So I think I can't overstate just being empathic and listening, but then obviously supporting and encouraging the person to seek help.